Dr. Josh Madsen here. I know a lot of you guys have seen us working with kids and all kinds of different developmental stuff, but I do want to show an adult what primitive reflexes look like. Many times you can have primitive reflexes for a multitude of reasons. In this one's case here, it's because we've had a lot of concussions, traumatic brain injuries. You'll see these reflexes come back, but it doesn't have to be that. It could be other stressors too, like chemical, emotional, or physical stressors that can bring these reflexes back. So I'm going to show you what they look like in an adult that has had a traumatic brain injury, in her case, multiple different traumatic brain injuries. So first ones I'm going to test are what's called a Moro Reflex. I'm going to put your feet together for me, please. Look straight ahead. You see that big startle response at first. Keeps blinking, keeps blinking, keeps blinking. That should stop after about like 2 or 3 of those. You can also have them look straight ahead and do a quick head movement back, and she has a quick response back like that. Or you can have them close their eyes, tip their head back, which she's going to have issues with because she has a Tonic Labyrinthine Reflex as well. But you pull them back quickly and you look to see where their hands go. Hers went straight up. That's your typical startle Moro reflex you see in an infant. Like if you kind of drop quick or someone makes a loud noise around them, their arms startle and they come out. The next one is called the Tonic Labyrinthine Reflex. This one should go away right around 3 to 4 months of life, current research says. But close our eyes. We're going to tip her head back. She should be able to maintain her balance, but as soon as we do, she starts hyperextending and losing her balance. We bring her head down. Everything flexes forward. We do these actually 3 times. So we're going to do extension, which we already know is off in her. We're going to do flexion, which we know is off on her because everything flexes forward and she actually starts losing her balance. And as we do it more and more, it actually gets worse and worse, and that drift gets bigger and bigger. And then we can close her eyes, put her arms straight out in front of her like this to check for a standing asymmetrical tonic neck reflex. So as we turn, you can see her arm starts to drop, other one starts to raise, and she starts to rotate with it as well. And again, as we do this more and more, you really start to see a drift. The bigger and bigger we get with her head movements here. Let's have you go on your hands and knees right here. I'll show it to you in another way too if she has them, which again, I haven't checked any of these yet. So let's have her drop her low back, bring her head down, both arms drop out. That's called your symmetrical tonic neck reflex. Should go at 8 months. This one, we turn her head, arm drops out on the opposite side, is your asymmetrical tonic neck reflex. Should go at 6 months of life. She also has a spinal galant reflex where we stroke her back, she curves towards that side. Let's have you sit up for me, hon. Look at my nose. So what we should see as we go side to side is her head should stay level at all times. These are your oculo head riding reflexes, which are not well developed in her. Close your eyes. These are your labyrinthine head riding reflexes. Her head should always stay perfectly level. What this tells us is that her vestibular system, you can open your eyes on, is dysregulated. And therefore she does not have those appropriate responses. So in everyday life, she has a bunch of different reflexes that are stopping or in the way of normal brain function and maturation. And if these aren't addressed, her balance centers won't efficiently function. Her eye tracking won't efficiently function. So we have to get rid of those first and foremost to help with that. Let's see what her eyes look like. I can get a dot on my finger. There we go. You sure so? Yeah, just put a dot on your finger. Look right at my finger and get a camera on her eyes. We want to see, is there any skips, any jumps in how her eyes, when they track from side to side? We shouldn't see any skips or jumps like that one. Random skip. Those are typically from your asymmetrical tonic neck reflex when we go side to side. And then same thing, up and down. We don't want to see any skips or jumps. Typically more related to your symmetrical tonic neck reflex, and same with this convergence. Ooh, you see double, don't you? So you should see one. That's called a convergence insufficiency. Her right eye is drifting and she's getting double vision. So, what shouldn't happen. But when you have a symmetrical tonic neck reflex, that will play into that. You can. Well, let's see if we can't make a change to that. I gotta check a couple things. Let's have you stand up for me. Turn face me, put your hands like this. Flip your hands over, back, over, back, over, back. All the way over, all the way back. See how right side's really quick, her left side's really uncoordinated. Arms straight out in front of you. Over, back, over, back, over, back. Right one's really good. Left one's really slow. These are tests for your cerebellum. Put one foot right in front of the other one. Her first movements are to the left. Close your eyes. Okay, open. So they're all hard for you, aren't they, hon? Okay. Put your feet normal. So I know her left cerebellum's weak, so I'm going to try to stimulate that first. So I'm going to use lasers to stimulate her left cerebellum, using some vibration to stimulate that, and then I'm going to do some eye tracking stuff. So look right at my finger here. And I want to see what sensory stimulus we need to do, or what areas of the brain we need to activate via sensory stimulus to make a change to these reflexes. Hopefully we can change them pretty quick here, but we'll see. Good. Because this helps us decide, for example, let's say we do left cerebellar stimulation here, and let's say it makes it better. We know that that's going to be a good therapy for her. If not, then we're going to try light, we're going to try sound, we're going to try a bunch of different stuff. Let's have you go on your hands and knees for me, hon. Adjustments are big stimuluses to your cerebellum. I always start with their extremities, though, just to start. Better, not gone though. This one's still pretty strong though. Let's have you stand back up again. Actually, take a seat. Let me try a couple other things. Just look straight ahead for me. So I'm using light, vibration at the same time, just in and out, getting her pupil to constrict on that left side, only on the left aspect of her visual field for her right brain. And kind of work my way up the developmental neurological chain here. Look at my nose. Good, look at my nose. Good. Getting tired at all? You're doing okay? Okay, hands and knees. So her ATNR is gone now. Her STNR is still there. Developmentally, it should go away later though. So let's have you stand up for me. Turn. I don't want to fatigue you out, so let me know if you're getting tired. Close your eyes. Good. Open your eyes. Put one foot in front of the other one, hon. Hold that by the wings there. Tell me which one feels the best balance-wise. One prior? Yeah. I'm going to use vibration and lasers just to stimulate her midline cerebellum and see if that will change stuff. So your midline cerebellum goes to your vestigial nucleus. Same with your vestibular system, your spinal system all goes through there. So I want to see if that will make a change just by stimulating that area. So that's why I'm vibrating along her spine, and I'm vibrating on a frequency that made her balance better. I'm lasering her midline cerebellum. If your vestigial nucleus is not functioning appropriately, you'll have increased sensitivity to sound as well. So go ahead, close your eyes for me. Okay, so that made her balance better. Okay, open your eyes. Put your feet side by side again. Close your eyes. So we're looking for any improvement here, because that gives us what the different treatment strategies we're going to do over the following weeks and months. Go on your hands and knees again. Let's see if that changes your symmetrical tonic neck reflex. ATNR looks good. STNR looks better. Not completely gone yet. Okay, let's have you lay on your belly. So if we're going to work on a midline cerebellum or a vestigial nucleus dysfunction, the biggest things that you're going to actually do is you're going to work on core stability, you're going to work on getting rid of primitive reflexes, and you're also going to work on the vestibular system and getting appropriate input through the vestibular system. And as that gets healthier and we get more energy to those areas, what you're going to see over time is those reflexes are going to start getting inhibited. And there's a lot of research that shows that when we have cerebellar dysfunctions and midline cerebellar dysfunctions, we'll have retention of primitive reflexes. Lots of studies that show that there's decreased volume of the cerebellum, especially the vermal areas and the midline areas, when we still have retention of primitive reflexes. So traumatic brain injuries can cause injuries in those areas, and if they don't get re-regulated, then you'll still see these reflexes being present. Okay, go on your hands and knees again. Good. Almost no dropping out there now. Good. So you sit up for me. Actually, sorry, stand all the way up for me. Doing all right?
Yep.
Feeling okay?
Yep.
Feel weird?
Yep.
Feel different, don't you? Hold that to your chest for me. Put your feet together. Close your eyes. Nice. Yeah, it's wild, isn't it? Yeah, so her main issue is her midline cerebellum, or what's called her vestigial nuclei. This is actually an area of the brain. There we go, hon. This is actually, let me see how your startle is doing. Good. No more startle reflex. You just hold on to that all day.
Yeah, I was like, I like this.
Yeah, exactly. So your midline cerebellum, that should actually develop in really the first months of life. And this could be a developmental issue, which I've never asked her about developmental history, if she crawled on time, all those types of things, or it could be from an injury. So I don't know the answer to that because I've never asked her, but the what we know now is that by stimulating that midline cerebellum, using certain frequencies of vibration, which is known to activate your cerebellum and your vestibular system, using low-level light therapy or laser light therapy to get more energy and blood flow to that area of her cerebellum, all of her primitive reflexes go away. So that gives us a strategy of we're going to utilize those things during therapy to rehab all of these reflexes. And just as you saw here, they'll go away very quickly just by giving the appropriate sensory stimulation and stimulating the correct areas of the brain.